Mhm.
Hello, everyone. Welcome to another review class for our lab students. And we shall this time discuss the TCM foundations, uh, focusing on the heart and small intestine, the Zhang Fu organs. Sir Regil, straight from Cebu, will join us, and we
Mm.
hope that he will be able to answer all 100. Good afternoon, Sir Regil.
Mayong hapon ka na tong tanan.
Okay. Sir Regil, what are Zhang Fu organs?
So Zangfor organs are internal organs of human body, the viscera, including the bowels.
Okay. What are the five Zhang? When you say Zhang, these are interior and in.
Yes, the in organs. So in organs includes heart, lungs, spleen, kidney, liver, and pericardium.
Okay, although we don't consider the pericardium as an organ, so bale anim na siya, no? Technically, there are only five.
Yeah.
What are the six Fu?
So the young organs, we have the gallbladder, stomach, small intestine, large intestine, bladder, and sanjiao.
Oh, I love the way you pronounce Santiao. I like it. I feel more, I feel less,
You feel more Chinese.
um, yeah, Chinese who hope to be born in London. Okay. What are the so-called extraordinary Fu?
Extraordinary food includes the brain, the marrow, the bones, vessels, gallbladder, and the uterus.
Okay, what are the functions of the Zhang, the tongue organs?
So, tongue, they manufacture, produce, and store essential substances.
I love the store. Okay. What are the functions of the Fu organs or the
So, food,
bowels?
yeah. So, they receive and digest the food, they transmit and excrete wastes.
Yun ang pala yun. Wastes. Okay. Connection of the Zhang Fu organs. How are they connected?
So, some four organs are connected via structural and functional connections by way of meridians or Tsinglo and collaterals.
Okay, where are the Zhang Fu organs located?
So they're located in the interior, but their physiological activities and pathological changes are reflected on the exterior.
Okay, let's now go to the properties of the heart. Let's start with the orifice,
So the orifice is obviously is the tongue,
the
and
manifestation,
yeah, it manifests in the face. And
the tissue
as
in
as for the tissues, we have the vessels
and the fluid.
and fluid. This is the sweat.
Yes, great. Let's go to the lung, the properties.
So for the lung properties, we have the orifice, the nose. Manifestation, we have the hair on the skin, and the tissues, skin tissue, and the fluid is the mucus.
The spleen.
So for the spleen, orifice, the mouth, and manifestations is the lips, tissues, organs, and the fluid is the saliva. Dok, kadali lang kayo, Dok.
Okay.
Kasi, kadali lang kayo. Nay, mangutana mo, good. Kadali lang ka.
Sige, no problem. Take your time.
Yes.
Now, for the spleen. Uh, I think we're done with this.
Um,
Liver naman, the orifice.
the orifice is for the eyes.
So when you say
Manifestations of
orifice, that means the liver opens into the eye, no? Manifestation.
manifests in the nails.
Okay, so that means if you want to determine the liver issue, the liver condition, you have to look at the nails,
uh,
the tissue,
uh, the tendons or sinews.
the fluid. Ay, bakit ka na?
Uh,
Hala,
the
the
tears.
fluid.
The tears.
Isa kawawa naman ako. Okay, kidney properties. Trying hard. Okay. The orifice, the kidneys open into
The ears.
the manifest are manifested on
The hair.
wow, the head hair, the
Yes.
tissue,
tissue, bones.
Fluid.
And the fluid is the spittle.
Okay, the spit, no? Ayun pala yun, dura. Okay. The function of Sang Fu is more emphasized than the.
The structure of it.
Okay. Heart is the blank of all the organs.
The heart is the monarch.
Yeah.
The emperor organ governs all Dangfu and the residence of the spirit or Shen.
Yes.
Dominates the blood vessels and houses the mind or mental activities, connects with the small intestine, opens into the tongue, manifests on the face, and the sweat is fluid.
Yeah. The fluid of the heart is sweat.
So,
Heart is the motive force for what?
blood circulation, the
You have rain there, no? Parang pangit yung signal mo. Normal blood circulation relies on what three factors?
vigorous heart chi, sufficient blood volume, and unobstructed vessels.
Okay, so if you have a issue on any of the three, then you will have, this will affect the circulation. Deficient heart chi and blood, please describe the pulse, or when you have heart chi and blood deficiency.
The pulse would be thready and weak.
Okay. Okay, what about if the heart is, if there is heart chi and blood stagnation?
It's choppy, the pulse.
Okay. What happens, or what are the symptoms that will characterize dysfunction in housing the mind or the heart?
There's insomnia, dream disturbed sleep, or unconsciousness.
Blood is the main material basis for blank.
For mental activities.
So if one loses his sanity, blame it on the blood. Deficiency. Okay, symptoms of heart blood deficiency.
Palpitations and insomnia.
What is the fluid of the heart?
The fluid is the sweat. The body fluid is used to make blood and sweat as the same source. Sweat comes from body fluid, and body fluid is most important component of the blood, and the blood circulation is propelled by the heart.
Okay. Pathological influence, that means the heart plus the sweat. Excessive perspiration leads to what? So if you perspire excessively, what will you experience?
Palpitations.
Profuse sweating or cold sweat from deficiency will result in.
Damage to the heart yang or dangerously excessive loss of fluid.
So bawal ang profuse sweating, no? Yun pala tinatawag nating cold sweat. Okay, the symptom in heart yang deficiency.
Spontaneous sweating.
Yeah, this is also true with the lung. Heart yin deficiency, the symptom.
Night sweating.
Heart functions well and blood is plentiful. How would you know from the patient?
From the patient's complexion and tongue. The tongue will be rosy.
Dysfunction of the heart reflects on the tongue and face. So, yeah.
Deficient heart blood, the tongue and complexion will be pale.
Okay, what happens to the tongue when there's flaring up of heart fire? What do you observe on the tongue?
The tongue tip will be red or ulceration on the tongue. Body, face will also be red.
Heart blood stagnation. Describe the tongue and complexion.
The tongue will be dark and purplish. Dark, yeah.
Yeah,
Tongue and complexion dark and purplish.
yeah. Okay. Describe the tongue when there is this function in housing the mind.
Okay. There's the tongue will be stiff or curly, or there's aphasia.
Okay, let's go to the physiological functions of the small intestine.
There's dominating, receiving, digesting, and transforming. It receives initial digested food from the stomach, further digests it, and then transforms digested food into food essence.
Okay. What exactly is meant by separating? Okay, can you discuss the ability of the small intestine to separate the clear from the turbid?
Okay. So it separates the clarity, an essential substance, from turbidity, residue of the food, absorbs clarity or food essence and water to supply, and then transmit turbidity or food waste goes to large intestine, water waste goes to the bladder.
Small intestine is like the official who performs what?
Performs a reception, it creates change of physical substance.
Pathological changes of small intestine.
The dysfunction in separating, dysuria, loose stools, diarrhea, abdomen pain, abdominal distension.
External internal relationship is between the heart and blank.
Heart and the small intestine.
Pathological relationship between heart and small intestine. What happens?
The first, it's accumulated heat in the heart. It moves to the small intestine. So there's deep yellow urine, oliguria, burning sensation in urination. Next is excessive heat in the small intestine, burns the heart upward along the meridian. So the heart fire flares up and leads to mental restlessness, ulcers in the mouth and tongue or tongue redness. And last is treatment. It clears away heart fire and promotes diuresis.
Okay. What happens in heart chi deficiency or heart yang weakness?
So there's retardation of blood circulation, or impaired dispersing and descending of lung. There's cough, shortness of breath, stuffiness of chest, and sensation of suffocation.
The heart governs all the blank and blank.
All the Zhangfu organs.
That's why everything is manifested on the tongue, diba?
Yes.
Heart chi equals blank of blank.
Function of the heart.
Okay. Heart blood is what?
Is the blood propelled by the heart?
What is known as the mansion of blood?
The vessels.
The physiological function of the heart in propelling the blood relies on.
The heart chi.
Okay, so pag affected yung heart chi, hindi magpo-propel yung blood, magi-stagnate, no? Titigil. Okay. Physiological function of the heart is reflected in the pulse. So pulse that is regular and strong means what two things?
It means first is vigorous heart chi and sufficient blood volume.
Physiological function of the heart is reflected in the pulse. Pulse thready and weak equals blank heart, blank and blank.
Deficient heart chi and blood.
Okay. Kaya when you have thready pulse, that means konti lang talaga yung dumadaan na dugo, no? Yeah. Physiological function of heart is, okay. If the pulse is choppy, what does it mean?
It means a stagnant heart chi and blood.
The heart houses the blank or blank.
Houses the mind or the Shen.
Heart takes charge of what activities?
The mental activities.
The word mind means
An outward appearance of the vital activities of the whole body, the narrow meaning of consciousness or spirit thinking.
These are all related to the function of the heart in housing the mind. What are these five?
Uh, the spirit, consciousness, thinking, memory, and sleep.
Mental activities are the function of the blank.
The brain,
In TCM, they are principally related to
the heart.
okay. Blood is blank basis for mental activities.
So blood is material basis for
The
mental.
function of the heart in housing the mind is closely related to its function of blank and blank.
Function of dominating blood and vessels.
This function in dominating blood and vessels, you list the symptom.
The mental activities will be changed or there's disturbed sleep.
Okay. How is your sleep?
It's good. So far.
Yeah, so that means okay yung heart natin so far.
Yeah, so far.
Okay, let's go to heart blood deficiency. What are the two predominant symptoms?
Palpitation and insomnia.
Actually, hirap siya makatulog talaga.
Mm-mm.
Takes several hours. Blank counts for body fluid, which is the most important component of blood. Blank is propelled by heart.
Sweat comes from the body fluid and blood circulation is propelled by the heart.
Yes. Profuse sweating indicates what?
Indicates a damage in the heart yang and dangerously excessive loss of fluid.
Kaya bawal mag-workout na sobra, no? Oh,
Yes.
like 5 oras.
I
Okay,
used to do
heart yang okay, the symptom in heart yang deficiency.
spontaneous sweat,
Heart yin deficiency.
night sweating,
Tongue is blank of the heart.
the sprout or mirror.
Okay. Physiological relationship between heart, tongue, and face.
First is the tongue is connected to the heart meridian interiorly, and then a lot of blood vessels on the tongue without skin cover and face. And heart functions well and blood is plentiful.
The blank of tongue and face reflect the functions of the heart.
The color and luster of the tongue and face.
Heart functions well and blood is plentiful. So what happens to the complexion and the tongue?
It will be rosy.
This function of the heart will be reflected on the blank and blank.
Reflected on the tongue and the face.
So if you want to see if the patient has heart issues, look at the tongue, look at the face. Heart fire flares up. The tongue, okay, what happens to the tongue?
The tongue tip will be red or ulceration on the tongue.
Okay, automatic. Then you also look at the face.
Yes, the face will be red also.
Okay, so that's heart fire flaring up. Stagnant heart blood or heart blood stagnation. Ito na yung kailangan mo na talagang kailangan na talaga tinitingnan ng cardio, no? So, describe the tongue and pulse. And complexion,
There's
sorry.
dark or purplish tongue and complexion.
Yes. Dark or purple.
Purplish.
Dysfunction in housing the mind. Blank or blank tongue or blank.
Stiff or curly or aphasia.
Inability to use or understand language, which is both spoken or written, because there is a brain lesion. What do you call this?
Aphasia.
The heart in TCM suggests all the functions of the blank and the part of the blank in Western medicine.
The functions of the heart and the part of the nervous system in Western.
So is it safe to say that to prevent dementia, no, Alzheimer's, we need to take care of the heart and the nervous system, no?
Mm.
The Chinese name for the heart.
Shen.
Okay, let's ask our consultant if this is the correct pronunciation. Sir Rachel, are you there?
Yes, I'm here.
Okay, can you resume?
Sorry.
What kind of happened? Shit. How
It's
do you
actually the
pronounce
same.
this?
Yeah, by the way, heart and the mind are the same word. Call it sin.
Ah,
Shen.
Uh, my
Shen.
son, yeah, my son's name is Isin, means one mind or one heart.
oh,
Oh,
okay.
Uh,
Amazing.
Shen.
Yeah.
sin.
Wow.
Okay.
Thank you.
Thank you. Thank
Sige, tuloy mo na. Thank you, Ma'am,
you.
Ma'am Trix. Tapusin
Thank you.
ko sa Rachel para hindi ako malate.
Sige, go.
Small intestine, the Chinese word is
Small means xiao, intestine chang. So xiao chang.
okay, that's easy. Xiao Chang. Okay, pag X pala, parang S lang din, no?
Yeah. Shorter lang.
The small intestine connects the upper end with the blank,
Stomach,
the lower end with the,
large intestine,
and the meridian communicates with the.
heart, sin.
List two physiological functions of the small intestine.
So first we have the dominating, receiving, digesting, and transforming. And the second one, we have the separating, the clear from the turbid.
Okay. Describe the first three main things that occur during the small intestine process.
First, we have, First, we have to receive the initial digested food from the stomach. The second is the further digest and initial digested food from the stomach. And the third one, we have the transform the digested food into kuti, food essence.
Describe the small intestine, separating the clear from the turbid.
So first, it separates digested food into clarity and turbidity, and followed by the clarity in essential substance that is absorbed. And the third, we have the turbidity of food waste goes to the large intestine. And the last one, we have the water fat waste goes to the bladder.
Okay, the water. Ganun pala yun? Kaya mo yan, Sir Jobel? The water. Small intestine ascends blank and descends blank.
So small intestine ascends clarity and descends turbidity.
Okay. So if you have more turbidity than clarity, then you cannot think well. Diba?
Absolutely.
Small intestine is like the official who performs blank, and it creates blank of blank.
So small intestine is the official who performs reception, and it creates change of the physical substance.
Pathological change in the small intestine. What three dysfunctions can occur during separating?
So first we have the digestion. So abdominal pain, we have abdominal distension. The second one, we have the abnormal bowel movement, loose stools, and diarrhea. The third one, we have the disturbance of the urination, dysuria.
Okay. Painful or difficult urination is known as
Dysuria.
dysuria. Okay, very good. The function of SI from a TCM perspective and Western perspective are similar or different?
They are just absolutely similar.
The meridians of the heart and small intestine connect with each other and form blank-blank relationship.
The external and the internal relationship.
Accumulated heat in the blank moves to the small intestine, which can cause what in the urine?
The accumulated heat in the heart moves in the small intestine, which can cause the deep yellow urine and the oliguria, and the first burning sensation during urination.
Okay. Yeah. Okay. The abnormally small production of urine is called
Oliguria.
oliguria. Excessive heat in SI can
Burn the heart.
yeah,
It really burns.
And this may result in
The heart, it results with the heart fire flares out, and we have mental restlessness. And of course, we can see a lot of ulcers in the tongue and the mouth. and the tongue is red.
Okay. If the heart heat moves to SI, or if SI heat burns heart, what is our treatment principle? What do we do?
So obviously, if it's hot, it's warm, it's burned, so you should need to clear the fire first, and then I need to let go of the water. So that means we need to promote diuresis.
Increased secretion of urine is cold.
So the increased secretion of urine is called diuresis.
Heart blank the blood.
It governs the blood,
Spleen blanks the blood.
makes the blood.
Liver does what to the blood?
It stores the blood.
If heart is weak and deficient, what happens?
So there may be some emotional issues. Then we have poor memory, then poor sleep, and dull thinking, and sometimes unconsciousness.
Okay, SI influences the bladder and what function?
So SI, urinary function.
Process of or drink.
Toxic. One na tiwas dok
Okay,
Trix.
no problem.
Nabisi man
Mom
ko.
Trix, can you
Sorry.
continue? It's okay. I know you're so busy. Mom
Okay, Doc.
Okay, can you discuss the process of food drink separation?
Wait, number.
Nine.
There. So we clear the stomach and the SI spleen or the stomach, and then from the stomach it goes to the small intestine and then the bladder, and then produces urine, and then if it's dirty, the stomach from the stomach it goes to the small intestine and then the large intestine, and then it becomes the stool.
Okay, so if it's clear,
If it's
it
clear,
passes to
it's
the
urine.
stomach, of course, this SI, then goes to the spleen, or the stomach, SI, bladder, and forms the urine. But dirty, still the stomach, until it goes to the stool.
The stool.
SI influences mental clarity and blank.
And judgment.
Yes. What is transformed before blood can be made? What is transformed before blood can be made?
Food or
Like
coochie.
my
Coochie.
accent.
It's food or coochie.
Yeah, food to coochie.
Gucci.
Yeah. Where does transformation of food to coochie occur?
The heart.
Yeah, stomach and small intestine. Meron tayong mali dyan.
Oh, that's
I double check it. Okay. Okay. What happens when you have a pale white face? White or dull face?
The heart young fails to warm and circulate the blood, leading to poor perfusion. Then there's blood deficiency, less nourishing effect on skin, leads to pale, dry, dull complexion.
Okay. So if you have heart deficiency, that means there is poor perfusion. Blood deficiency can be seen on the skin. So the skin is dry and dull. Okay, what does the purple or blue color complexion tell us?
That there's blood stasis, chi stagnation or cold, obstructing circulation or poor blood flow.
Okay.
Wala pa, wait lang. Sandali. Ang bilis naman. Okay, when you have a red complexion, malar flush, butterfly-shaped redness on the cheeks, what is the path?
It means deficiency in the yin.
Okay, so you have, yeah. And the last one, wow, last na, finally. Red face, bright red flushed face.
Red face means excess yang or heat.
Okay, thank you so much, everyone, for joining, especially to Sir Rachel Andaya of Cebu and Mom Trix Guevara of Manila. And we hope that you can join us again next time. our topic will be spleen and stomach. Maraming salamat po sa lahat.